Good afternoon. I'm Ed Ullman. I'm the pharmacist here at Wellness RX, the beautiful pharmacy and wellness center on the mountaintop in Tannersville, New York. Last week we spoke about the emerging trend of the coronavirus. I told you that as a pharmacist and a trusted health professional, I believe it's my public responsibility to talk to you about this issue and other issues that impact us. We talked last week about how the influenza virus that hits our community each season, especially during now the winter season, and we stressed that about the emerging coronavirus, that this is serious, and we must be concerned and we must be prepared. As an update to last week, fortunately, 8 out of 10 of the influenza and the coronavirus cases remain mild in nature. And patients still start to feel better in about a week or two. If there's intervention with an antiviral medication like Tamiflu or natural products, the duration can be reduced significantly. And the other good news that it now appears that kids are still not being infected from the coronavirus. That's really good news. We're tracking now the fatality rate from the coronavirus closely. While less than 1%, if not closer to 0.5% of patients are dying from the influenza flu, the fatality rate from the coronavirus has now increased from 1.4%, which was last week, to 3.4%, as described by the World Health Organization. And with both flus, where we're finding that the majority of deaths continue to be older seniors and patients with chronic conditions like COPD. So one of our big clusters of deaths in the United States was in a nursing home in Seattle. And so we are a little skewed with our results as of right now. Worldwide, there are about 100,000 plus cases that are being reported. This is basically, they've been tested and they're reported of the coronavirus, with now Italy being the hardest hit outside of China. In Italy, they are quarantining in the northern part millions and millions of individuals to try to be cautious if they can get the spread of it to stop. In the United States, as of this morning, we had 460 cases that were reported in 30 states. We had 20 deaths, or we're dealing with a fatality rate of 4.3%. Now, while the coronavirus remains an unknown, and even the best experts that are on top of this that you listen to will tell you the same thing, here are some facts that we know. The coronavirus is now clearly different than the influenza flu that hits us each year. Now, for example, we're used to the influenza virus to start to decrease its impact as warm weather comes. And we then generally look at April as being the last month that we see flu shots at our wellness center. Well, all deals are off with the coronavirus. We don't know if it will respond that way with warm weather or not. So we cannot anticipate that. We're going to be watching it very closely as it evolves, but it is very different and it will be a work in progress. Last week, the good news is the president signed legislation that earmarked $8.2 billion to fight the coronavirus. Now, the good news is that most of that money, or at least a large percentage of that money, will go to our states and our local governments to prepare for and to respond to the fight of the virus as they see it based on the public health conditions and where the clusters are starting to break out more in urban versus rural and so on. We're also going to see a major increase in our capacity to test for the virus. And this is important, especially if we get the authorization to use local laboratories as testing facilities. because as we start to test more, obviously we're going to see more patients testing positive. We then will have an increase in the numbers of patients that are reported as having the virus. But most important, we're going to be able to identify carriers, individual patients who have tested positive but have no signs and have been having the potential to go out there and to expand and make a lot of chaos for our communities. So that's our big challenge, and that's our big hope with testing. How can we be prepared? We got to continue to follow the conventional wisdom for prevention. Wash your hands for 20 seconds, hot soapy water. We especially got to be concerned with public doorknobs, countertops. We want to use hand sanitizer. We know that there's been a shortage, so we've been making up more at our wellness center for people. Don't touch your face, sneeze into your arm. And again, remember the most common way that we get the influenza or the coronavirus will be from breathing in particles or droplets of airborne flu. One sneeze can contaminate up to 6 feet around us. Now, we also identified last time that all flus can have no impact with antibiotics, or no antibiotics will have any impact on a virus. Therefore, we must combat a virus infection with a strong immune system, antiviral drugs, and antiviral natural products. Our immune system is our best defense system against any germs that are entering into our system. And once the germs come, whether that germ is a virus, whether it's a bacteria, whether it's fungal, whether it's a parasite, we shoot out white blood cells in order to try to best protect our system. So we need to have a strong immune system, and that's going to be a combination of hydration and diet and stress management and exercise and proper sleep and with supplements. We also strongly recommend that, especially our high-risk patients, that they have consultation with their doctor early on to prepare for a potential problem. The doctor relationship is critical and important, and we want to anticipate what we can be done and not wait until we have a crisis situation, and then it's very hard to get in to see your doctor. Also remember, for maximum effectiveness, the antiviral medication Tamiflu is best when it can be used within 48 hours after one has identified itself with having a virus. Daily supplements, we continue to recommend a high quality probiotic, and we continue to recommend antiviral and immune strengthening natural products. What we've found that we still recommend mushroom tincture. Mushroom tinctures, the chaga and the reishi, are two excellent ones that have antiviral, immune boosting, and can be extremely important for us. Take it as a prevention. We also recommend elderberry tonic, which is safe for adults and kids, and it also works fast, and it is antiviral. We also continue to recommend that you increase your vitamin C, 500 milligrams 2-3 times a day, because it's water soluble, will give antioxidant protection. And we also suggest that you add immune boosting foods to your diet. Garlic is excellent, sauerkraut is excellent, and just Google and get foods that will be easy for you to introduce. Most importantly, we want you to try to prepare for that if you or a member of your family or someone you know that does feel that they're coming down with the flu, they have the symptoms that are easy to identify, the chills, the fever, the cough, and that we start to see this. Obviously, we want them to go make an appointment to go see their doctor or to an urgent care facility. But we also want them to be able to say that whether or not they have Tamiflu or not, if you can take the elderberry tonic, increase it to 1 teaspoon to 2 teaspoons every 4 hours. Increase your mushroom tincture from twice a day to 3 times a day. We also recommend that you start to increase the vitamin C to at least 1,000 milligrams every 4 hours. If you have taken too much, your body will respond by diarrhea, then you stop and you reduce the amount but continue to use vitamin C. We also recommend that you take a teaspoonful of 500 ppm colloidal silver twice a day for 5 days. And if the budget allows, a high quality echinacea extract is highly recommended because it is also a strong immune booster and is antiviral in nature. The next few weeks will be challenging for us as a community, for us as a nation, and also as a world nation. News reports will continue to come, and we'll try to do the best that we can to understand what is happening. And we have to just understand the sources are going to be different, and the reports can sometimes be scary. We got to remain calm. We have to use prudence. And we still recommend that you look and turn to the CDC, the Center for Disease Control. I believe that they are the most accurate in allowing us to understand protections we can take and how the virus is expanding in our country. We will try to keep you up to date of this coronavirus, hopefully on a weekly basis. We ask you to call if you have questions, and understand that we as Americans, our American healthcare system, our American public health system, our American educational system, and so many other things are now going to be challenged. This is our moment to see how we deal with a national public health challenge. I believe we're going to do well, all right? But most important, what's being challenged is our decency to each other. Let's be kind. Let's be calm. Let us show who we really are as Americans, and how we treat each other is a way we can demonstrate it. Good luck.